First of all, thank you AIUS for including this program on OCTA in the glaucoma diagnostics. I'll be speaking on what is the current role of OCT angiography in glaucoma management. I have no financial interest in any of the technologies that I might discuss or mention. Glaucoma, as we know, has varied etiologenesis. There are different hypotheses for its genesis, and one of them is vascular hypothesis. So glaucoma is basically a neuropathy, optic neuropathy, and it's believed that at least some patients, they have a significant vascular component in this genesis. Is a consequence of insufficient blood supply because of either increased intraocular pressure or decreased blood pressure or perfusion pressure, or any other reason which can reduce the blood supply to the eye. There's ample evidence to suggest that the circulation or circulatory disturbances produce a significant role in genesis of glaucoma, and also one of the earliest, well-conducted randomized controlled trial, any early manifest glaucoma trial, also suggests that low perfusion pressure could be responsible for some of these, in the genesis of some of these glaucoma patients. So now we have OCT angiography. So what is the role of angiography that's going to discuss in this talk? So OCT is an emerging tool that we know. It provides a non-invasive, high-resolution, high-quality images of the vasculature of the retina, choroid, and the optic disc region. Now, this area has been very difficult to image. The blood supply of the eye is actually very difficult to image. We don't have a very reliable way of knowing the exact blood supply, but I think OCTA has given us some opportunity to study this aspect of the retina, choroid, and the optic disc region, and has contributed significantly to our understanding about the different pathologies there. So this is based on SSDA, split spectrum amplitude decorrelation algorithm. So I'll not go into details of the physics, but most of the time we use a search source OCT or some other way of OCT basically, and with a complex algorithm, we get a map of the retinal circulation in the area that we are studying. It provides both qualitative and quantitative assessment of optic nerve head vasculature as well as the peripheral retina. So this is just to give you, some example how it looks like. The OCTA can give you the vascular pattern on the surface of the retina. It gives you kind of an en-fast image, and that one can adjust the depth. So it could be on the surface of the retina where you will see the peripapillary, in the peripapillary area and in the optic nerve head, you can see the capillary plexus. Or you could go a little deeper into the deeper layers of retina, and also you could go even deeper into the choroidal area where you could see that how the choroidal circulation is. So basically, this gives you an opportunity to study in the retinal, the vascular pattern in different layers of the retina at different depths of the retina. And this can also correlate with the OCT image, which can be acquired at the same time. So that gives us good understanding of what is happening in the different layers of the retina and which part of the vasculature is actually functioning or is not functioning. So typically, glaucoma diagnosis and monitoring, we have a number of tools. We have structural testing, we have functional testing. We still depend a lot on the visual fields for the diagnosis as well as monitoring progression of the disease. And in the structural testing, OCT has actually almost become a standard now that all patients we monitor glaucoma patients on OCT as well as to look at the retinal fibrillary thickness and also certain optic disc parameters. But I think now we also have another tool, the OCTA, as I mentioned earlier. So this can give us the vasculature of the optic nerve head area and in the peripheral area. So that is another tool that we have now for the structural testing, basically focusing on the blood vessels or the vascular supply. So in OCTA and glaucoma, as we know, that this is a non-invasive objective way of assessing of the vasculature around the optic nerve head. And whenever there is a glaucomatous damage, we know that the microvasculature dropout or the capillary dropout has been seen in the areas where there's a glaucoma damage. And based on this image, we can calculate the vascular density or the VD. There's the percentage of area covered by the vessels over total area of the disc. And the OCTA machines, they have a built-in algorithm, built-in software basically to analyze this aspect. And also we can actually subject these images to third-party software, the image analysis software, and it can get some of these parameters like how much is the area which is occupied the vessels and how much is the total area, and that gives you some percentage of some percentage of area that's covered with the vasculature. So that gives you a kind of an index to compare with the before and after, or compare with other eyes. So the total area of vascular density decline corresponds with the area of nerve fiber loss in OCT. So there's evidence that they kind of correlate with each other, and that's the reason that OCTA has become one of the tools in diagnosis and managing glaucoma. So what exactly the role of ACTA in glaucoma? I think that's what we are going to look at. So the vessel density in the optic disc flow, or the flow index in the optic disc area, it has been seen that this is kind of a reduced in glaucomatous eyes as compared to healthy eyes. And there are a number of studies now which actually suggest that there is a correlation between glaucoma and the vasculature and the reduction in vasculature in the optic disc area or in the peripheral area. Also, we know that there are areas of vascular density decline on OCTA that coincide with the geographically with the areas of the structural and function. So there is a correlation between the structural loss, as we see in the OCT, like if you have a nerve fiber loss or nerve fiber thinning, and corresponding area, the same area actually would show a decrease in the vasculature or the capillary dropouts on OCTA as well. So the two, they correlate very well with each other. And also these two correlate with the visual field, because the corresponding visual field, corresponding area in the visual field is more likely to show visual field defect. So that way there's a good structural and functional correlation between the OCTA, the OCT, and the visual fields, because these are the three modalities which are very commonly used now to monitor and diagnose glaucoma. So this is one of our patients, 56-year-old female patient. This patient was diagnosed as NTG, and we did diagnose variation. The IOP was always within normal range. The IOP was maintained in the lower teens with one anti-glaucoma medicine, and we didn't find any progression over a period of 9 to 10 months follow-up. But as you can see on OCTA and on OCT, so you can see on the picture on the left side, on the superior upper and the left side, upper left quadrant, you can see that there's a marked decrease the capillary density in that area. And if you look at the OCT, the nerve fiber layer projections here, so this also suggests that there's a corresponding the same area of the OCT is also nerve fiber layer is thinned out. So two are kind of correlating, and that gives you a confidence that what you are looking at kind of is the same thing, with like you have a problem pathology detected in OCT and something which is also corroborated by the OCTA there's a vascular decline in that area as well. This is another example. This is from a POAG patient, 6 years old male patient, has been on treatment for POAG, and this kind of a early disease. You can see on the right side picture, this is an OCTA picture, and in the red circle there, there's some decrease in the vascular density in that quadrant. You can see a very nice vascular at the capillary bed in the peripapillary area, but you can see that there is some thinning, some decline is seen in one quadrant. And this actually corresponds somewhat to the visual field, the scotoma in the visual field as well. So again, the two are, there's a correlation between what you see on OCTA and also what we see later on the visual fields when we do that. So that again is another indicator that the OCTA abnormality that we see, they also collaborate with the functional testing on as done on the visual fields in these glaucoma patients. So again, the same point that all the three, the nerve fiber layer on OCT, the OCTA, and the visual fields, there's a correlation in what we see. So the question is, can it help in early diagnosis? Now, if we look at the whole image of vessel density and circumpapillary vessel density, they're kind of match, more or less they match with the retinal fiber thickness in differentiating healthy and glaucoma suspect. So, there are a number of studies now which kind of support this, that whenever there is a nerve fiber thickness, the areas where there is a nerve fiber thickness, reduction in glaucoma patient, those are the areas which also show decrease in the capillary, as I shown our examples earlier. And also the OCTA measured peripapillary vessel density and peripapillary nerve fiber layer and OCT comparable in this. They are comparable in distinguishing mild glaucoma eyes from the control eyes. So even for the early disease, I mean, when the diseases are advanced, there would be a capillary dropout and nerve fiber taking, which is which is easy to pick up. But even in early disease, there is a correlation between the capillary dropout areas and also the OCTA. There is a little bit of uncertainty in the sense that does what precedes, whether the OCTA, like capillary dropout areas, precede the retinal nerve fiber thickness, or is the capillary dropout areas secondary to the damage to the nerve fiber which has already been taken. So that this probably is not very kind of sorted out, but probably there are some patients, those who have a vascular dysregulation, maybe they could be the patient where the capillary changes might be preceding the retinal nerve fiber layer, or the other way around. But there's a correlation between the two. Now, OCTA measurements detected glaucoma change in macular vessel density in eyes without evidence of change in DC. Now, this is important. It seems to suggest that if you do the OCTA in the macular area, and there we also have the retinal ganglion cell thickness, the retinal ganglion cell complex also undergoes thinning in glaucoma patient on OCT. So if you now look at the OCT and OCTA in the macular area, this paper shows it, and Zhang and others, it suggests that maybe OCTA changes might be preceding the retinal ganglion cell thickness changes in the macular area. So that again points toward the OCTA being able to detect early disease glaucoma early. Good discriminability or peripapillary vessel density, then that of the macular vessel density for distinguishing normal versus pre-perimetric glaucoma was also noted in the study. So, so this basically points towards the ability of the OCTA to help in early diagnosis of glaucoma. Other thing is what was the progression? So how do we analyze the progression of the disease? So this is again from our own patient. This is 59 years old male patient. He was diagnosed with UAG and was on two anti-glaucoma drugs where the IOP was maintained. And these two pictures was taken some, about 10, 11 months apart. And as we can see, the nerve fiber thickness in the spherotemporal quadrant, it shows some change, some decline is there in the nerve fiber thickness over a period of 11 months. And that is also seen in the OCTA, where the vessel density is gone, a little bit, some 2-3 percentage points in the same area. So statistically, it didn't reach the kind of significance in this particular patient, but definitely there is some change for the worse, which is seen in both the images like OCT as well as in the OCTA. So again, the two are corresponding with each other. On functional testing on visual field, there was no change, appreciable change was there, so that was not detected. Whereas the OCT and OCTA suggested that there is some decline in the structural structure and also in the vascularity of the vascular bed in one quadrant. So that again suggests that maybe the OCTA has the ability to pick up progression also uh, uh, in these patients. It could be useful in detecting progression as well. So structure function correlation is quite good, and glaucoma patients with microvascular dropout on OCTA showed significantly more changes, chances of visual progression later on. So what this means is that I think this is again published in AGO 2019. What it suggests is that OCTA is useful not only in diagnosing glaucoma or picking up progression, but it can also suggest that a particular patient is at a risk of progression, of visual field progression. So it could, so OCTA changes can also kind of predict or point to the risk of finding changes on functional testing as well. So again, this points toward the utility of OCTA in glaucoma. So if you look at the OCT versus OCTA for progression, then OCT, again, the OCT has a disadvantage because in advanced glaucoma, there's what we call a floor effect. So whenever most of the nerve fibers are thinned out or lost, OCT will still give you some structure, some values there, and which indicates non-neural elements basically. And the OCTA will still show that thickness, and that's called the floor effect because OCT will not go, values will not go any further, even if the glaucoma is progressing. But in OCT or OCTA, the floor is not reached that early. I think even if the floor effect has come on OCT, the OCTA will still continue to show progression in the vascular bed, in the capillary dropout areas. They still keep on increasing. So the OCTA will still be useful when OCT reaches the floor effect. So it can be used to monitor progression even in advanced glaucoma patients. And in that sense, it complements visual fields. So visual fields, as we know, are better than OCT in monitoring progression in advanced glaucoma patients. And OCTA complements visual fields in that respect. And also, as we know, it's an important tool to assess risk progression as well. So OCTA has many advantages. One, it is a non-invasive tool because we not using any dye. So all the risk associated with injection of a dye and inconvenience and cost is taken care of. It gives you high resolution images and there's no obstruction of images as we see in FFA and ICG when there's a leakage of the dye. So You can see the vascular bed clearly in the early phases of FFA, for instance, but once the dye starts leaking, then it obscures, the vascular pattern. Acquisition time is quite short in the OCTA, and also there's quantitative as well as qualitative analysis. Both are possible of the vascular bed in OCTA, and also it can give you the vascular bed in different layers of the retina. So that is a big advantage over the conventional in vascular imaging. But more very important is that there's a high reproducibility. These three images were of the same patient taken at small some interval of time, and we can see that they are very much similar. There's no difference in these images. So the reproducibility is also quite high in OCT images. So that makes it a very good modality for imaging vasculature around the optic nerve. However, there are certain disadvantages of OCT as well, and it's prone to artifacts. So sometimes there could be projection artifacts or ghost images of the superficial vasculature can impose on the deeper layers. So there could be shadowing artifacts or motion artifacts, and sometimes the software which we use to segment different layers of retina and different structures, that can also cause errors. And then if there are media opacities, so then they will have impact or kind of a inverse or negative impact on the vasculature of the retina that we are trying to study. Also, the values that we get on OCT are not actually true flow values. So they are, they're kind of a there's an indirect measure of what's happening in the RBCs, because OCTA actually is looking at the motion of the RBCs in the vascular bed, and from there it's that kind of indirectly deducting the amount of blood that is present in that area, but it is not giving you the true blood flow values. So that is a disadvantage, and also it cannot directly measure the volumetric blood flow or the flow velocities. So it has its limitations in that regard, but still it's a very useful technique. So to summarize, OCTA is a non-invasive tool to study retinal vasculature and has several advantages. It correlates very well with the other modalities for diagnosis of glaucoma like OCT and visual fields. OCT has a potential to pick up glaucoma early as well as progression early, and it can be useful in monitoring progression even in advanced glaucoma, where conventional OCT, the OCT is not as good. So it can be used along with visual fields even in advanced glaucoma for monitoring progression. Thank you very much once again, AIOS, for including this into the program, and thanks for the opportunity.